All right, last little bit of this unit is the blood vessels of the pelvis. We are going to start by looking at the aorta. The abdominal aorta extends into the false pelvis. Remember, that is the area below that arcuate line. The arcuate line is the imaginary line that runs from our sacrum to our pubic bone and basically divides our pelvis into true and false pelvis. The aorta does bifurcate around the level of L4 into common iliac arteries. That would be right common iliac and left common iliac. At the sacroiliac joint, the common iliac artery then bifurcates again into something known as the external and internal iliac arteries. That's essentially what you're seeing in this picture. The SI joint, remember, is where sacrum and iliac join. And then right along that line is where we get internal and external arteries. The internal iliac artery is the smaller of the two. It extends posterior and medially into the pelvis. It then branches into anterior and posterior trunks. This provides blood to all the pelvic organs of the true pelvis. So if we look at this picture, we have abdominal aorta that then extends into right common iliac, and then we get internal iliac that divides here, internal and external. The internal then is a short trunk, a few centimeters, and then it divides into anterior and posterior trunks. The internal iliac artery runs into the pelvis. That's why it's called internal. The external iliac artery is the one that's going to run externally down the leg. So here's a cross-section of this picture. This picture gets a little confusing, but it is nice because it shows that we have anterior and posterior trunk of the internal artery. And then I have the external iliac artery here, iliac vein, and another internal iliac vein. Now, how do I know these are veins versus arteries? Good question. The arteries tend to be smaller. And if you look in most studies, when they're looking at blood vessels, they're going to use contrast. The contrast is going to go through that arterial side. So we can see this has contrast in it and this has contrast in it. We're getting not much of it in this little branch, but we're hardly getting much of that vessel at all. The external iliac artery, like I said, is the one that runs down to the outer part of our leg. And by outer part of our leg, not the outside of our leg, but out of our pelvis. The large vessel does not ever enter the true pelvis, and it extends along the pelvic brim and through the inguinal ligament and becomes common femoral artery. So essentially it changes names as soon as it crosses this brim, which I put a little line here just so you could see it. There is known as the inguinal ligament. It's synonymous with the groin or your crease in your leg, where your leg and your pelvis join. Essentially, that vessel just changes names as it courses over that location. So it's external iliac artery above that. And then as it courses down your leg, it changes names, and we call it common femoral artery. Since we're out of the pelvis at that point, that's all that there is for arteries. So external iliac essentially comes right off of common iliac. Internal iliac also comes off common iliac, but then that further bifurcates into anterior and posterior iliac arteries. So jumping over to the venous drainage, it follows a similar pattern as the arteries. The internal iliac veins and tributaries drain into the pelvis. It ascends in the pelvis in the medial and internal iliac artery, ascends the pelvis medial to the internal iliac artery as it returns blood from the pelvic viscera. Venous plexus drains mainly into the internal iliac vein. The external iliac vein is an extension of the femoral veins. It returns blood from the legs, and it courses medial to their respective arteries. And then they become more posterior as they ascend and join the common iliac veins at that SI joint. Common iliac veins arise posterior to the common iliac artery and common iliac veins confluence to form the IVC at the level of L5. Notice I use the word confluence here instead of bifurcate, and that's essentially because our vessels are coming up our leg and joining at L5 and then become IVC. IVC does sit slightly to the right of the midline, which most of this you all have seen before. I am going to jump up to this picture here because I think there's some veins on here. Yeah. All right, so we can see our vein here. This would be our external, common femoral vein, then becomes external iliac vein, and then it joins to form inferior vena cava. Last little note here is there is a lymph node chain that follows the corresponding blood vessels throughout our body. Lymph nodes are going to be very, very common to be seen in the pelvic and inguinal region. This will be a common thing that you're going to find when you're doing a vascular study by ultrasound. And we don't consider lymph nodes enlarged unless they're measuring more than 10 millimeters in an axial cut. So that's in a transverse slice. So longitudinally, they can even be bigger than that. It's very, very common to see enlarged lymph nodes. This picture is of an MRI just to give you an idea of how many lymph nodes are actually located along this pelvic region. You can see all those little dots that you're seeing. Those are all inguinal lymph nodes. Their jobs are to drain the lymph and help remove excess fluid from that venous return system and help absorb the fluid that's put off out of that venous system. If you look in a cross section, which is this smaller picture here, this is our hip and acetabulum and ball and socket essentially, and we can see all sorts of little tiny femoral lymph nodes there. This can be very, very common that you're going to see. You should not have to pick these out, but if you see them on an image, or they might have you look at one that looks suspiciously large on another imaging study, they might have you look at it by ultrasound.